Hello everybody, this is Gary. Today is May 31st, 2022. It's 10:59 a.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today I'm doing okay. I'm sticking to my daily schedule. I did my physical therapy exercises and my exercise bike. I did some work on my computer. Making this video. Later today I have an appointment with my physical therapist, and then I have to go to the pharmacy to pick up some medications and some other items. But my anxiety levels today are pretty low. My paranoia levels are pretty low. I feel actually pretty calm today. My auditory hallucinations are not that intense. Like I said, my paranoia and my delusions are not that severe today. Depression and anxiety is at a minimum. The physical pain in my right knee is starting to lessen. I was able to use my exercise bike without too much pain. I had surgery on May 13th on my knee, and I'm still going to physical therapy to get my knee rehabilitated so it's not hurting as much as it was, say, 2-3 weeks ago, or before and after surgery. I had the surgery on May 13th. Tomorrow is the 1st of June, and I will be seeing my psychiatrist. That visit will be my last appointment with that particular psychiatrist. He's a resident. He will be moving on to his next phase of training in his medical psychiatric career, and I will be assigned probably another resident. I go to a mental health clinic that's publicly funded, mostly through Medicaid and Medicare, and they use psychiatric residents, which are medical doctors. They can prescribe medication, but they're in the middle of psychiatric training as well. And each resident that comes in is going through a training, and they also actually treat patients while they're being residents. They've already earned their medical degrees. So I was talking to my psychotherapist, and she said she would find out as soon as possible, probably within the next week, who my new psychiatrist is going to be. If there's a delay in seeing a new psychiatrist, we'll probably have one of the main full-time psychiatrists cover my medications and any problems that may pop up with my psychiatric situation or my psychiatric prescriptions. It's always difficult to have to change doctors, whether it's your primary care doctor or your psychiatrist or your psychotherapist. It's just difficult. I mean, I've been through this. I've been going to this clinic for a while. It's called Strong Ties. It's part of the University of Rochester Medical Center. And I've been going through Strong Ties for the past 6-7 years. And I've switched psychiatrists 4 or 5 times within that 6 or 7 years. Because there's always a turnover of residents. I mean, it's just the nature of their job. And I have to get used to a new psychiatrist every 1 to 2 years, depending on where the resident is in their training. So it's always difficult. But I do have my psychotherapist, which is not changing anytime soon that I'm aware of. And I'll be seeing my psychotherapist on the 13th of June, I believe. And I will be starting group therapy sometime in the second week of June, I believe, on Wednesday. I have to check that out, but I am going back to group therapy. My group therapy was delayed by my knee surgery. It wasn't possible for me to keep a weekly schedule when I could barely walk around on my right knee. But my right knee is starting to feel better. I'm still taking pain medications for my right knee. Motrin, Tylenol. Cymbalta, Neurontin, and Flexeril for physical pain. Of course, I'm not on any opioids for physical pain. I had about 2 or 3 days supply of opioids when I had my knee surgery, and of course they won't refill that prescription once you use it up. There's too much of a risk of addiction, and so I only had about 2 or 3 days of Percocet when I had my knee surgery. But I'm feeling better today than I did last week. Last week was pretty crappy. I will be going to physical therapy today, seeing my psychiatrist tomorrow, going to group therapy in 2 weeks, and seeing my psychotherapist on the 13th. And actually tomorrow I'm not seeing my psychiatrist. Tomorrow I'm actually seeing the orthopedic specialist to check out my knee after surgery. I'm not seeing my psychiatrist until the 2nd of June, I believe. Yeah, sorry about that. That was a mistake. I got too many medical appointments coming up. I'm confused. It's hard to keep track of everything. But there's nothing else really to report on. I'm doing okay. Like, comment, share, subscribe.